Hello, good day to all. Today let us see some revision questions or quiz on hyperkalemia. Question number 1. What is the first line treatment for someone who is in severe hyperkalemia? A. Sodium bicarbonate. B. Ventolin. C. Calcium gluconate. D. Insulin and dextrose. And the correct answer is option C, calcium gluconate. Question number 2. The average amount of potassium ingested daily is 420 to 500 milligrams, 3500 to 5000 milligrams, 70 to 100 milligrams, 7 to 10 milligrams. And the recommended average daily intake should be between 3500 to 5000 milligram, which is option B. Question number 3. A patient is hyperventilating due to emotional distress. You would expect the potassium level in the patient's blood to increase, decrease, or remain unaffected. And the correct answer is increase. Actually, in hyperventilation, the respiratory alkalosis causes the potassium to be released by the cells into the blood to balance the pH. Question number 4. Potassium is mainly excreted through the kidneys, the GI tract, respirations, normal cell decay. And the correct answer is kidneys. Question number 5. Ventolin is useful in the treatment of hyperkalemia because it causes bronchodilation, prevents reuptake of potassium in the small intestine, increases the rate of potassium shift into the cells, stabilizes the cell membranes. And the correct answer is option C, increases the rate of potassium shift into the cells, as Ventolin has beta-2 effect. Actually, the beta-2 agonist causes or activates the sodium-potassium ATPase pump. Thereby, the potassium gets shifted into the cells, thereby reducing the blood potassium levels. The next question is, which of the following ECG signs will typically occur first in hyperkalemia? Tall, peaked T waves, prolonged PR interval, flattened P waves, widening of the QRS complex. And the correct answer is tall peaked T waves. Next question. At which level of hyperkalemia can you expect to start seeing a widening of the QRS complex? 3.5 to 5.5 milliequivalent per liter, 5.6 to 6.5 milliequivalent per liter, 6.5 to 8 milliequivalent per liter, or greater than 8 milliequivalent per liter. And the correct answer is 6.5 to 8 milliequivalent per liter. Initially, when the potassium level is higher than the normal, the T wave will start to peak. The next change is widening of the QRS complex. When is a dialysis patient's biggest risk at being hyperkalemic? Right after dialysis, right before dialysis, 2 to 3 hours after dialysis, 24 hours after dialysis. And the correct answer is 2 to 3 hours after dialysis. Next question. The sodium-potassium pump pumps sodium out of the cells and potassium into the cells, potassium out of the cell and sodium into the cell, sodium and potassium into the cell, sodium and potassium out of the cell. And the correct answer is sodium out of the cells and potassium into the cell. Next question. A patient has a potassium level of 9. Which nursing intervention is priority? Prepare the patient for dialysis and place the patient on a cardiac monitor. Administer spironolactone. Place patient on a potassium restrictive diet. Administer a laxative. Answer is prepare the patient for dialysis and place the patient on a cardiac monitor because hyperkalemia can cause fatal arrhythmias. Next question. Which patient is at risk for hyperkalemia? Patient with parathyroid cancer, patient with Cushing syndrome, patient with Addison's disease, patient with breast cancer. The correct answer is patient with Addison's disease. A deficiency of aldosterone in particular causes the body to excrete large amount of sodium and retain potassium, leading to low levels of sodium and higher levels of potassium in the blood. What percent of total body potassium is in the extracellular fluid? 2%, 8%, 20%, or 80%? The amount of potassium present in average human body is approximately 50 milliequivalent per kilograms. Of this, 90% is found in intracellular fluid, 8% in skin and bones, and only 2% in extracellular fluid. Though only minor percentage is present in extracellular fluid, the maintenance of this relatively small amount of extracellular potassium is critical. Even a small change can cause serious and critical clinical consequences. The next is, severe hyperkalemia is defined as a serum level of 2 milliequivalent per liter or greater, 4 milliequivalent per liter or greater, 6 milliequivalent per liter or greater, 7 milliequivalent per liter or greater. And the correct answer is 7 milliequivalent per liter or greater. Mild hyperkalemia occurs at serum levels of less than 3.5 milliequivalent per liter, but greater than 3 milliequivalent per liter. Moderate hypokalemia at 2.5 to 3 milliequivalent per liter. Levels less than 2.5 milliequivalent per liter are considered severe. Mild to moderate hyperkalemia is defined as a serum level of 5.5 to 6.9 milliequivalent per liter. But severe hyperkalemia is a serum level of 7 milliequivalent per liter or greater. Next question. Which of the following foods has the greatest potassium content? Cola, banana, blueberries, potato chips. Answer is potato chips. Here is the food and the potassium content. French fries of 5 ounces have 17.7 milliequivalent. Potato chips 1.5 ounces has 10.2 milliequivalent. Banana, a smaller size, 8.6 milliequivalent. White mushrooms of 2.5 ounces, 8.1 milliequivalent. Orange juice of 7 ounces has 7.9 milliequivalent of potassium. Whole milk of 7 ounces, 7.7 milliequivalent. Cooked broccoli, 2.5 ounces, gives 5.8 milliequivalent of potassium. Blueberries, 3.5 ounces, has 1.9 milliequivalent. White chocolate, 0.75 ounce, gives 1.8 milliequivalent of potassium. Cooked onions, 2.5 ounces, gives 1.5 milliequivalent of potassium. Cola of 14 ounces has 0.2 milliequivalent of potassium. Of the options given, potato chips has more amount of potassium, that is 10.2 milliequivalent per liter. Thanks for watching. If you like the video, please like and subscribe to get notifications. Thank you. Hello, good day to all. Today let us see some revision.